Dr. Rupe Hansra, welcome to the podcast.
Thank you, Steve. Good to be here. Big fan of your podcast, by the way.
Well, thank you. I appreciate that. We're off to a great start. So I think a lot of people listening to this know who you are, but for those who don't, if you don't mind, just introduce yourself real quick and let us know a little bit about who you are and what you've been up to.
Sure, thank you. Yeah, so I'm Dr. Rupe Hansra. I am Vice President of Professional Affairs for Topcon Healthcare. I've been in the industry for over 20 years. I think that's why probably a lot of folks know me over the years.
So you and I today are going to discuss a topic that's on a lot of OD's minds, and that's AI. And it's an area that you've spent a lot of time, maybe more recently, focused on, both maybe just your own personal interest, like a lot of us, but also within your role at Topcon. We're going to talk about how it's transforming eye care and maybe even going to broader healthcare overall. I think we're still at a time where you get a lot of different reactions on the topic of AI.
Yeah,
IDOC, we host some regional dinners, and recently we had these dinners, and the focus was AI, and it was an interesting mix of reactions that we heard. Some are using it a lot, others are just dabbling in it. You've got
right.
some saying it's a waste of time, and it's not. I wonder if those are the same people saying the internet was a fad, and so were smartphones. But maybe before we take a deeper dive, just on a broader perspective, how do you see AI transforming eye care and maybe just healthcare in general?
Yeah, no, I think maybe a good spot to begin with is, and I love what you had mentioned. I mean, there's a lot of fear, anxiety. Uh, AI is such a big, broad topic, and from what you had mentioned, and I love what you said because AI is already here, and it's not something that's coming down 5 years, 10 years down the road. And if we apply it and we do so in the right way, it's going to make us much better clinicians, and it's going to make us much better communicators with our patients. It's going to impact healthcare overall. I think what you're seeing right now is a larger trend. You're seeing some of the big tech companies, whether it is Microsoft, whether it is Meta, whether it's Amazon, they're all getting into this space. And so it's going to impact us one way or another. And it's better if we can control our own narrative being eye care practitioners.
Would you say we're behind the curve in terms of the rest of healthcare? And let me mention something specific because I heard you talk about this before, and I'm just curious on this point, if this is something where you see AI making an impact. But when I took my son recently for some he had a few things going on with his back, and I had to take him to a few different doctors. And the whole system, the whole network is very interconnected in the hospitals and the clinics I had to take him to. We really don't have that in eye care. We're very siloed. So maybe there's a two-part question: is that something you see AI impacting, and maybe on a broader perspective? As I look, that was just one small example of eye care, but I mean, overall, are we behind in terms of AI and technology?
Great question, and I think we are right at the right spot. We're right now at a huge inflection point where we're going to need to start making some decisions as an eye care community, whether we want to adopt this or not. And radiology, from what I understand, has been leading the way in terms of using AI in imaging to help diagnose and detect. And so they've been doing this for quite a while. I think for us, when I was at Vision Expo West, I have this slide courtesy of the Wisconsin Historical Society. And when you look at the slide, it actually has a picture of a doctor or a patient in the exam chair. You've got some trial lenses, a phoropter, a keratometer. Now, interestingly enough, Steve, is that picture was taken in the year 1933. So, to your point, in the minds of our patients, the perception might be, well, look, all you guys do is kind of spin dials and refract, and you do glasses and contact lenses. And we know as ECPs that's not really fair to say because so much has changed in our profession over the past 100 years or so. So we have new pharmaceuticals that are really breakthrough, new surgical techniques, and then we have what's really impacting us in a favorable way is diagnostic capabilities such as, the Maestro OCTA, which can get down imaging down to the micron level, which gives us all of that information that we can actually use in our practices.
Can you drill down a little bit more on that? Because I see two main areas where AI is going to impact eye care, and one is maybe more in my world, and the other might be closer to your world. But I focus more on the business side of things,
Mhm.
practice management. So I think there's a lot of really interesting things that doctors haven't even tapped into in terms of the business managing a practice
Mhm.
aspects. But on the clinical side, it's really interesting how that's transforming the doctor's ability to make decisions, to prescribe treatments. How do you see that changing? Let's say over the next couple of years, even the next 5 years, where a doctor now has to rely on many cases an N of one, right? We're relying on our
Yeah.
own knowledge base, on our own experience. And no matter how good of a doctor you are, it's very limited. Well, we're moving into a time where we're going to now have a lot of the information and data consolidated from what hundreds of thousands, maybe millions of people at some point, that's going to allow for better decision making. So, how rapidly do you see that happening?
Yeah, it's going to happen very, very rapidly. And the reason is, and I'll get into your question around big data because that's exactly where we're going to be going. It's because we currently have a broken healthcare system. I mean, we spend more money in the United States on healthcare than any other developed country, yet we have of the worst outcomes. Maybe 1 in 5 Americans have not seen their physician in over 5 years, and 1 in 6 of them have some type of chronic disease. But what we do know is that they're much, much more likely to go see their eye care practitioner. And then so when you take the data that you're talking about and our ability to interact with patients more frequently than any of the other providers, and imagine a world where we can run a wellness scan, apply an AI model to it, compare it to a database that you've been talking about that maybe has 1 million eyes. Now, all of a sudden, we can not just draw out eye care insights. Now we draw out overall health insights, such as cardiometabolic, neurodegenerative insights, so on and so forth. And so what that does then, it moves eye care practitioners from inside our four walls, which we've been stuck at for the past 100 years, and puts us more in the center of this connected care ecosystem. And so when we do it that way, as we move forward with AI, uh, the eye exam is going to be much, much more important into connecting with other physician specialities. We're going to be very, very central to all of that, courtesy of retinal imaging and big data. Hope that makes sense.
Absolutely. And I think it's safe to say medicine is going to become much more customized and tailored by the data we get. So it's no longer going to be how things perhaps were when you and I went to um, school, where things seemed a lot more standardized. But I think AI is going to allow us to look beyond just the medications we prescribe and give more customized feedback in terms of nutrition, lifestyle. How often should we have to have them come back? We have in our head, let's do a 3 month follow up or a 6 month follow up. Maybe they need a 2 week follow up. All that data coming in, would you say is going to change things too in terms of the scope of treatments that we're able to provide in a much more personalized manner?
Yeah, personalized precision medicine, that is the future. And so what is so interesting about what you had mentioned there is that we can then aggregate and organize these very, very large data sets, apply AI models to it, and all of a sudden, now what we're doing is we are detecting very early, predicting and stratifying through risk all sorts of diseases which you and I may take us a while to get to in multiple visits and multiple visits. I mean, some of those things, I mean, imagine Alzheimer's, Parkinson's, for example, being able to detect that through an eye exam. We're not neuro-ophthalmologists, and nor are we neurologists, and we don't have a panel of tests right at our fingerprint that we can go ahead and go have a patient go through this battery of tests, and then 2 weeks later get some feedback and say, and then to go ahead and make the diagnosis. most often we're detecting and collaborating with neurology when somebody then has an issue with their vision, when they're already having an attack of MS. Now all of a sudden you got an optic neuritis sitting in your chair. Now they're a suspect, right? And so then we send them out to neuro-ophthalmology or neurology, and lo and behold, a month later we may get the feedback of exactly what's going on. But imagine, at the point of care, through a rapid non-invasive retinal image, we're able to derive those insights right there and then.
You mentioned something before that was pretty sobering but true, that our country spends more on healthcare than any other country, but we have some of the worst outcomes, which we really think about that, whether you go, what's going wrong? So I suppose it's my hope as well that having this additional data and maybe some added certainty around the diagnosis will allow for better outcomes. Because I think just in general, I think once we have this data, maybe patient hesitation, skepticism comes down. I joke in some of my presentations about how, doctors think patients always, I'm a doctor, patients always trust what I do. No, they're called second opinions. People get them all the time. But once we have more data to back up why we're prescribing this medication, why we're asking them to lose weight, why we need them to come back in 3 months, my hope anyway is that there'll be more trust in the the why behind what we're asking patients to do.
Yeah, and one thing I've seen, I've probably sat in on, at minimum, probably about 400 eye exams, is that as doctors, there's a lot of variability in the way that we actually communicate. There's a great book by, I think it was Jerome Grootman, What Doctors Think. And what he shared was that doctors, we interrupt patients. I believe it's within the first, 15 seconds or 30 seconds, something along that. The higher the specialty, the worse communication skills that we have. And so to your point earlier, by having all this data at our fingertips, by using then AI to be able to create these wonderful printouts that you have, like with Toku's BioAge or AI's Health, when they have these printouts, and it's a great way for us to have a document that demonstrates for a patient, okay, for like Toku, it's green, amber, or red. This is what the data is saying, that, look, it's an opportunity for me to then just double click, and I'm going to need to run some more tests on you because this is what the data is showing us. And Toku's printout is actually very fabulous. It's designed to be very patient-centric and patient-friendly. So instead of what I'd see is this variability in the way that the doctors communicate, and sometimes, they're explaining and re-explaining and re-explaining. Sometimes they're talking in very technical terms that the patient way above their head. But to have a standardized approach in terms of how we communicate with doctors and have this as the sort of the cornerstone in terms of how we communicate, it's going to be very valuable for patients to get to understand that. And so, imagine, much like when you're getting blood work done, you've got this range of normal. And if it's outside the normal, we'll have a printout that we can share with the patient and say, look, it's not definitive, but I need to run some more tests on you.
The book you mentioned was How Doctors Think. Is a fantastic book, by the way. I highly recommend it. It's very it's humbling, I think, for a physician to read it. You mentioned, I don't know how I remember this, but the time between the patient sitting down. This is what they found in that book. The time between the patient sitting down and the doctor interrupting the patient. You
18
mentioned
seconds.
you mentioned 15. You're way off. It's 18. We give them 18
Yeah,
whole seconds.
it came to me
Yeah.
later on.
Yeah, it's
And
18.
in that book, also, if I could interrupt you, because that's what we do as as doctors, I also remember that patients have four questions that they want to ask the doctor. And what they end up happening is that the most important question they say for last, and they never actually ask the question because either they felt that the doctor, they ran out of time, or they felt the doctor didn't care, or they kept getting interrupted. And so again, there's an opportunity for us to become much better communicators. And I think AI is going to help a ton with that.
Yeah, I agree completely, and that's probably maybe we'll have you come back on to discuss that. But I'm exploring that quite a bit lately, and the doctor's role, AI's role in helping the doctor with some of these issues, and again, maybe a whole nother topic. So you and I were both at Vision Expo West, and we had dinner together, and you were talking about something. You're talking about something called Oculomics, and I said, "What's Oculomics?" And so I'm going to ask that now for the people who don't know. Tell us what that is.
Well, before we go on, it was a great dinner, and as a vegetarian, I could really appreciate us going to a steakhouse. so, so yeah, Oculomics wasn't on the menu, and so Oculomics. If I could rewind in terms of what Oculomics is, it's very easy to understand. So we've always known that there's a relationship between your eyes and your overall health. So we already mentioned MS, cardiovascular disease, high blood pressure, diabetes. We know that this stuff shows up in the back of the eye. Now, in about 2017, give or take, that's when cloud computing systems really took hold in terms of research. And so now what that allowed us to do with cloud computing system is to aggregate and organize these very, very large data sets. And then we can apply AI models to it and then start to draw these connections. So when I say these data sets, I'm not just talking about imaging, but I'm talking about clinical metadata that would live in your EMR. And then probably around 2020-ish or so, that's when generative AI came about. And what generative AI allowed us to do, it allowed us to take these AI models and be able to deliver them in real time in a cost-effective manner. And so what that has done with the science of oculomics, it allowed it to speed it up. So these AI models now become very well refined. We started applying other AI models and drawing additional insights. I mean, some of the things may not even be believable. One of them is not only renal disease, but drawing a correlation between preeclampsia and your retina. I mean, that's the kind of thing that we're talking about here. So oculomics really is the science, the modern definition, so to speak, not the Pierce-Keen definition, but the modern definition is the science of applying AI to retinal images to draw out health insights, both systemic as well as ocular.
Where are we at right now in terms of accuracy on a lot? And maybe you could speak directly to Topcon and the research that you guys are doing. Somebody mentions this to me once, and it was an interesting way of looking at it, that the patients and maybe even regulators allow human beings more margin for error than they're going to allow technology. So the technology from a regulatory standpoint and from a patient expectation standpoint is going to have to be more accurate. I think we were talking specific to AI. So where are we at in terms of that? And does it even have to be? Or is that even the right question? Or is it just a matter of it's helping the doctor make better decisions? We're not looking for it to make the decisions for us, but it's giving us more data to be able to make more accurate decisions.
Well, that question is a great question. And one of the issues that we're facing, and I'd love to talk about this a little bit later, is that the technology now is far outpacing the regulatory. And so, innovation is happening literally at lightning speed. And so there are a lot of AI models that are out there. You may take a look at Topcon Healthcare's. If you follow our CEO, Ali Tafreshi, who's amazing, by the way, it seems like he is posting every week sort of a new company that we've acquired or a new collaboration with us. What you don't see behind the scenes is that in the last 2 years, we've probably evaluated over 650 different companies. We've vetted them. Ali Tafreshi personally has been involved in that. And so we've rejected, or we've sort of helped encourage others and direct them on the right path. So not all AI is equal right now. There's a lot that goes into it. It's not only the algorithm, it can't be made in a black box. There has to be explainability to it, so to speak. But the data sets that it draws from, those need to be ethical and representative of the populations that you're actually screening. And so there's a lot of variability into what these developers are building. And so what we've done is that we've we've either started an organization, one of those organizations is Alliance for Healthcare from the Eye. The other is that we're a member of, I think it's called Trustworthy Responsibility and AI Network through Microsoft, which then, is all about collaborating and putting standards in place to ensure that your AI is credible, that it is drawing from the right databases, it's ethical. And then there's a way, because you're going to get drift over time with AI, that there's a way to ensure that these AI algorithms are still valid, and then they are getting adjusted to ensure that they're doing the things that they're supposed to do.
Yeah, and that's always been a concern with AI, and it's a valid concern, even for basic generative AI. Is the information that it's giving you accurate? Now, if we're just playing around with it, we could ask it to give us the sources. We could ask it to only choose information or only reference information. Let's just say from help me out here, peer reviewed
Peer reviewed.
articles. I'm not even going to edit that later. I'm just leaving that right there. So, I mean, there are workarounds with that, but obviously there's more at stake when we're talking about the clinical side of things. So it's good to hear that. I assume there was, but it's good to hear that there are, systems in place and network. I think you mentioned one, the Trustworthy and Reliable AI network, I think it's called, but that there are processes being put in place to monitor and oversee these things. Because I think these are some of the things that doctors worry about.
Yeah, and so the name's coming to me now, and it's the Trustworthy and Responsible AI Network. And again, they're dedicated to operationalizing trustworthy AI all across healthcare. So not just with us in eye care. And so the member organization, Train then helps, through Microsoft as their experts in this stuff, helps develop, helps them adopt and share best practices to ensure that AI is then being used responsibly and ethically. And so then again, the overall goal is to create a more efficient, affordable, and more equitable healthcare system. And I think Train, Microsoft's been one of the leaders with that. We just had gotten, American Academy of Optometry just happened in Boston, and the American Academy of Ophthalmology just met in Orlando. And so this Alliance for Healthcare from the Eye, are you okay if I just touch upon that a little bit, because it dovetails right in?
Yeah.
So that was initially started with Topcon Healthcare, Alita Freshy, Dr. Robert Weinreb from Shally Eye Institute, and David Rue, Chief Medical Officer of Microsoft. And they meet twice a year. The first meeting is at Arbo annually. The second meeting is at the American Academy of Ophthalmology. So the Alliance really has four major sort of initiatives. One is the expansion of affordable access to healthcare. Two, it's ensuring responsible use of AI and patient data. Three goes back to what we discussed earlier, which is coordinating care across systems. And number four is supporting long-term health outcomes and cost reductions. And so this is not just Topcon or just Microsoft. This is a consortium of healthcare systems, physicians, payers, researchers, policymakers, regulators, folks that are experts in data privacy, representatives from industry and government. They're all dedicated to scaling and creating consistency with Oculomics. And that's a beautiful thing. And so we encourage participation on that. As a matter of fact, when I was at AAO Optometry, we presented the Alliance for Healthcare from the Eye to the deans and presidents of all of the optometry schools. And we have a few of them that are already members. I think New England College of Optometry is one of them. Illinois College of Optometry is another. UAB, College of Optometry. I think UAB overall is, but it's not just that. I mean, imagine the American Heart Association being a part of that. Imagine the NEI or NIH having representatives there. That's how big this organization has gotten. I think it's called the Community Collaborative on Ophthalmic Innovation. I think it's Melvina Edelman's group. They're also members, and they're also helping us kind of work with government entities around CPT codes and standardization around the science of oculomics, which is so young.
And another concern, which it might fall under these other entities you're talking about, is the privacy concerns with information. We started out talking about how siloed optometry was, but I think that also allows us to contain things more. So now we're talking about situations with the AI where there's obviously more sharing of information, interconnected models, and I don't know. Is that something that's being actively monitored, or are we still a little bit in the Wild West of that territory?
No, it is very actively monitored. I think cloud computing systems, we all use them. For us in particular, we have a gentleman named Ray Everett, who's 30-year Silicon Valley expert, who is our general counsel and compliance and leads compliance for us. And we've had many conversations around this. And so, whether it's data sharing, whether it is the cloud computing systems, running the AI model through it, it's I think the caveat here is, and I gave up 20 practices to come over here to do this because I believe so strongly in what we're doing here. I think it's going to be it's going to be the next evolution of eye care. But when I talk to Ray, it boils down to this. Now, in my 20 practices, what would happen from time to time is, hey, Dr. Hansra, here's a patient, here's what their retina looked like. And by the way, I sent this picture to the retina specialist. Well, how did you do that? I texted it to them through my cell phone. Now, when you're talking about compliance, that might not be the best approach to do it. When we send data through, let's say, a clearinghouse, so we've been sharing data, whether it is through managed vision care or these large payers like Blue Cross Blue Shield, through clearinghouses, so on and so forth. We've been sharing data and doing so in the cloud for many years. So what we're talking about here is not anything new, but it is a great opportunity for us to then go back to the basics, because in some cases we might have gotten a little bit sloppy. And what I mean by that is, are we sharing passwords at the office? Do we have a hierarchy over password protection? Who gets to see what data, and do we have those systems and checks and balances within our office itself? Those are the kinds of the things that we probably need to do. And a nice review of HIPAA while we're at it might not be a bad idea in and of itself. But in terms of data privacy and security, for us, it's stored on the Microsoft cloud through Azure. It's secure, it's scalable. It's something that we've been doing, in this space and in healthcare for many years.
I'm going to ask you to step away from your current role just for a moment.
Sure.
I heard somebody once say, you don't have to like trends, just don't ignore them. So I want you to put yourself in a position of a doctor who operates a practice, owns a practice, works in a practice, and is looking at AI, but not quite sure how it's going to fit into their practice or what they should be doing. What would you tell that doctor now to help them lay the foundation in their practice for artificial intelligence?
So again, to your point, we are right at that inflection point, and we can start laying that foundation right now without, jumping in the pool, right? We can start to stick our toe in the water, but the decisions we make around instrumentation today, considering the life of an instrument being 5 to 7 years, then may dictate 2 years, 3 years, 4 years if you're not Oculomics ready. So, while I do want to take a step back, I think it is important because Topcon, I believe, is by far and away setting the global benchmark for this. And so this this goes back to our robotic imaging devices that we have, at Topcon. And so when you have an OCT, I think you can use any OCT that you want. But why do I like, a Maestro OCT? Why do I like a NW500 fundus image? Because they're robotic cameras, and that's going to be extremely important in terms of you're ensuring you've got valid input into your AI, because these robotic cameras, one touch, consistent capture every single time. They're designed to minimize operator variability, and that results in highly consistent image capture. Now, that consistency translates into more reliable data input, which then is an essential factor that feeds into your AI algorithms. So, the higher or the more reliable the data input that goes into the AI algorithm, that's going to translate into better output, and that's going to give you a better result. So for me personally speaking, I would choose, and you can choose any device that you want, but I would choose a robotic OCTA, or a slit scanning technology camera like the NW500, which is going to not only robotic, but it gives you that slit scanning technology gives you high resolution, true color sort of fundus images, which then allows the AI to read all those little hues that you may not be able to be detected through the naked eye. So it's really good data input into that algorithm. Second thing is, I think for the future, and then is to get on a system like a connected care platform such as Harmony. So much like you have an iOS that sits onto your the application sit into your hardware, which would be your cell phone. Sitting on top of Harmony then would be the applications, and you can pick or choose any application that you want, because it's not connected to your device. It runs through Harmony, which there's many advantages, and that's why Apple does it with their cell phones. They don't connect it right in the device itself. They connect it, on the iOS system. Hope that makes sense.
It does. And to anyone who has questions about that, but before we close out here, I want to give you an opportunity. I could probably talk all day with you about this stuff, but anything else you want to cover? I appreciate your time today. It's a really interesting topic, and I hope, if nothing else, those people I referenced earlier that were just kind of on the fence about it, or thinking it's not going to have a big impact on eye care. It probably is. I don't see a way where it doesn't have an impactful effect. So I appreciate, if you're that person, you're still listening. I appreciate the fact that you're still here, but just pay attention to what's going on. But anything else you want to add before we close out?
Well, first of all, I'm hoping to have a steak dinner with you real soon. And,
It didn't stop me from
organization,
eating steak, by the way. I mean, I felt bad, but you had a great meal. But I
I
noticed
did.
nobody else at the table. It didn't prevent them from having steak. So sorry you had to
No,
witness that.
I'll have a steak dinner with you anytime. Um, I think organizations like IDOC, which is an amazing organization, but you have these study groups, and to be able to just engage and have those conversations, and then get out there and explore. I think instrumentation right now. If you're in the market for instrumentation, while you may not be thinking AI, I think it should be in the back of your mind in terms of the instrumentation that you choose today that's going to then lay that foundation, because that foundation has to be really strong, because in the next 12 to 18 months, I think we're going to see, eye care really flipped upside down, and for the better. We'll be in the center of that connected care ecosystem. And I can't wait to, hopefully you'll have me back on in a few months, and we can talk about all the great things happening in eye care.
Yeah, I would love to do that. Where can people find out more information about any of this stuff? Would they go to TopCon's website, Oculomics? For those saying, I really want to know more about the technology, what TopCon has to offer, where should they go to find that information?
Sure, you can go to the Topcon website, or go to the Alliance for Healthcare from the Eye. I think both of those are great places to start. Or if you want to hit me up, feel free to email me or reach out to me anytime. You can find me all over LinkedIn, or my email address is rhansra@topcon.com, HANSRA@topcon.com.
Thank you. Thanks so much for your time. Really appreciate you coming on. Appreciate sharing all the insights, all the knowledge, and I really appreciate Topcon and all the work that they're doing as well.
Are you a great host, Steve? Thank you again. Hope to be back soon.
Well, thank you. Thanks to Dr. Rupe Hansra, and thanks everyone for listening. We will see you in the next episode.
All right. Take care now. Bye bye.